Good evening, everyone. Thanks for joining us again tonight on the Will and Dave Show. Tonight we're going to be talking about something a little slightly harder than the last couple of nights. In the sense, we're talking about Northern Health and healthcare workers in North America in general right now, and just how much pressure they're under with the current health crisis. And we want to dive into that a little bit, and we'll probably touch on a couple of other related subject as well. But yeah, we just wanted you to be aware of that before we get into the show tonight.
Welcome to the Will and Dave Show.
Hello, William.
Hello, Dave.
I am way more brightly lit than you.
Yes, you are.
In
You're very,
current
very
culture,
bright today.
that would mean a whole new thing. I'm more lit than you.
Jesus. I quit. I'm out. Bye. I abdicate.
You abdicate.
I don't want this anymore.
So let's get our sponsorship stuff out of the way, and then we'll come back to this.
Yeah.
If you want to support the show, folks, you can head to Buy Me a Coffee / Will and Dave Show, and you can buy us a cup of coffee for $5. We'd appreciate it. We'd thank you.
For those of you who don't know, the name is a kind of a misnomer. It's metaphorical. It's for the price of a cup of coffee. You can support the show. You don't actually literally buy. I mean, we might buy a cup of coffee with what you give us, although I like to think we have better things to do with the money. But yeah, for the price of a cup of coffee, you can support the show.
It is an American $5 bill, so in Canada that would be like 18 coffees. But
yeah, perks of being in Canada.
And now we would like to introduce the sponsors of our show. The sponsor for this episode is Northern Truss, your one-stop shop for floor systems and for all your truss needs. Phone the team at Northern Truss at 250-787-3033. Locally owned and operated in Fort St. John, BC.
Hey there, and thanks for tuning into the Will and Dave Show. I'm Susan, and I don't know about you, but I think that in the whole world there's nothing as warm and comforting as a handmade quilt. And quilters the world over have wonderful stories to tell. So to showcase their stories, I host a podcast. It's called Measure Twice, Cut Once, and Other Life Lessons Learned from Quilters. You can tune in to the podcast anywhere that podcast apps are, whatever your favorite is, or you can find a direct link on my website, stitchedbysusan.com. And now, back to the show.
Hey.
With that out of the way, let's get into the meat and taters of today's show.
Well, let's not get into meat and taters yet. It's depressing.
I mean, yeah.
How was your week?
Depressing. My employer may have contracted COVID, so they're staying home sick. So the workplace was pretty bustling this week, trying to work around that.
So what you're saying is when the cat's away, the mice do not play?
We do not play. We stress a lot.
I'm sure he'll be glad to hear that.
It's one of those things where, you know, when the guys on the ground, like us in the shop, and we're working on the floor and everything, it's really easy to turn up our noses at the guys in the office because they could just sit in a chair all day.
That's right.
But the amount of crap that they take care of and handle on a daily basis that we don't even think about boggles the mind. And I think for me, but I think especially for some of the other guys, it's been a bit of an eye-opening experience now, getting to see just how much value there is in the guys and the work they do upstairs.
Well, as you work for my brother, I'm sure he appreciates hearing that.
I'm sure. When he feels better and can come back in the shop, I'll tell him how much we appreciate him.
I was on the phone with him earlier, and he said he feels good. He still is waiting on results because apparently in Canada it takes forever to find out if you actually have something or not.
It can. Like I've gotten test results back as fast as like almost 48 hours. So some people I've talked to, other people it takes like a week. It seems to
Which
vary very
which is
greatly.
silly.
I'm not sure. I'm assuming they have to. It takes time to get the results, and in some cases they may have to send them out. I'm not sure. I know we send some tests out here in the frozen north.
In 48
Like,
hours you can infect half of the country apparently.
yeah, that's why you're supposed to quarantine before you get tested, not just like after you get the positive result.
So when you
So
think you have it, you're supposed to quarantine?
you're supposed to treat it like you're infected until you find out otherwise. Yeah.
Oh, oh gosh, don't even get me going. So yeah,
That's the way
I
it
have
works.
a friend who passed away this week of COVID,
Hmm.
and he actually did. He passed away of COVID. It was a friend of the family, and it seems like this is touching every aspect of our lives. It definitely is hitting every aspect of the show, which is sort of depressing at times. But
Hmm.
it is it hits home when it's somebody that you know
Yeah.
and they pass away. And for me, it made me relook at my skepticism
Hmm.
of the response of my response to COVID and to the whole thing. And I do want to say on the record, and I think we've been saying this for a year and a half, ever since we started doing this, it's real.
Hmm.
I don't think either one of us, for sure not you, and I know I'm fairly certain that I have not said it's not real.
Yeah. Yeah. I
We
mean, we've
do,
dithered and disagreed about the weather twos and the how we handle and manage it, but
right.
neither of us has ever bought into the idea that it's some sort of hoax or boogeyman.
Well, yeah, I think it is a boogeyman, but I think it's a real boogeyman. I
Yeah.
think this is not a Stephen King boogeyman. This is a real boogeyman,
Yes.
and it kills people.
Yeah. A lot of them.
The question, the differences that I have in relooking at it and again re-examining my skepticism, it's still there. My skepticism, unfortunately, for those of you who like to laugh at me and my skepticism, it's very real still.
Hmm.
It brings it home, and I wanted to re-examine why I doubt the government, because I do. Why I look at the Faucis of this world and I see a lot of ulterior motives, and I don't believe everything that they say to me. It's hard when you have a friend who passes away, though, and it was COVID. It really
Yeah.
was. He died of COVID, or he died of pneumonia, although it was caused by COVID or vice versa,
Yeah.
however it
Yeah.
happens. But yeah, it was COVID. And it really makes you re-examine your your uh, your doubt and your skepticism.
It's really close to home. It kind of cuts to the quick of everything.
It really does. And now I have some family members who have it,
Hmm.
and I won't lie, I'm looking at them pretty carefully. I'm calling them more often, even though they don't always answer the phone.
Who would possibly? What? I have no idea who you're talking about.
Which makes me phone more often because then I'm more curious. But hey,
Making sure they're not dead.
that's right.
Which,
Um,
I,
Go ahead.
yes, like I've been exceptionally lucky, and I recognize how lucky I've been between living in a higher density populated area, or more densely populated area in Ontario, being near to Toronto and Ottawa and whatnot, and then traveling across the country and getting here, and here being a place where many of the regulations around COVID are kind of either lax or ignored. And I have had very little personal contact with people who get sick, people who are injured or die. Like I don't think anyone I'm super close to has passed due to COVID. I mean, a couple people, yourself included, have caught it, but fought it off, and it's been fine. But
Well, I should clarify that the will. I believe I had it. I had all the symptoms of it, except I don't like to be a
oh,
government number, so I never went to get tested. So I have a daughter who says that
naughty, naughty.
well, I did quarantine, so if that makes you
Yes,
feel any
yeah,
better, I
it
stayed
does.
home. But yeah,
But yeah, like I've been lucky that it hasn't hit me personally particularly hard. I mean,
right.
obviously, infrastructure and how I interact with local businesses and whatnot, that's been affected. And
Hmm.
yeah, it's a nuisance. But that's the worst I've had to deal with on like a personal level. Is it just being a nuisance? I haven't had to deal with any earth shattering effects. Nobody's died. Nobody's had permanent damage done to them that I know of. So I count myself lucky. And this is not me saying it's good that someone died, but I feel like that gut punch, that reminder, that cuts quick to the heart is something that we need to keep in the forefront, because just because I'm lucky and haven't had a lot of personal interactions with COVID and its side effects does not mean that other people aren't dealing with it constantly on
Right.
such a massive scale right now. If we look at the infection rates in the States, they're huge, huge again. And so many people are dealing with this. So many people are having to deal with all the fallout, the health costs, the actual like physical health issues that come along with it, but just like the
Yes.
bills. The time in hospital for a COVID patient costs a lot of money. I mean, even here in Canada, the cost to hospitals is, I think, is estimated at something like $50,000 per patient, approximately, over the course of an infection if they end
Oh,
up in
I
the
would imagine
hospital.
it's more than that. Right.
Yeah, that's
ER
that's like a low
rooms.
ball.
Yeah, I think ER rooms are that per day.
Yeah, it's insane.
So yeah, it is real. There's no doubt about the disease. There is doubt about the doubt on my part about the response. And I
Hmm.
won't lie, I still have that doubt about the response to the disease and to. I had coffee with a friend of mine this week, or actually, I didn't have a coffee. I went to Costco. I got a $1.50 hot dog with a friend
Hey,
because it's cheaper than a coffee, and I got a hot dog and a drink. But
yeah.
we were talking about the response to COVID, and he said, even after your friend died, you still doubt. And I said, yes, I still doubt. I have a friend who dies of a car wreck. It doesn't mean I believe that the Department of Transportation is perfect. I mean, it does not affect how I view the role of government in it. It means I had a tragedy in my life, yes.
Hmm.
And and so we started to talk about ivermectin, and he says, if you mention horse dewormer, I'm getting up and walking away. And I'm like, no, I won't mention horse dewormer, except I will mention ivermectin because it is a human drug as well as a horse
Yes.
dewormer. And
Oh.
so Joe Rogan, as you heard, I'm sure you heard, he got it. And of course,
Hmm.
he threw everything but the kitchen
Every,
sink at it.
yeah.
He got over it fairly quickly, including ivermectin.
Hmm.
And he was joking, saying he's going to sue CNN because they said that he used horse dewormer. And he said, no, I went to my doctor and he prescribed ivermectin. It's actually a thing that you can get for humans.
Hmm.
Now, I will say, I know people who are going and getting the horse dewormer, are grinding it up and taking horse dewormer. And to those people,
Stop.
I have a hat for you. Well,
I
I can't find my hat, so I'm not
don't
going
know
to
if I've ever wanted to like play a meme on the this
on the
as much
show.
as I want that clip of Michael Jordan from the '90s in that old like it's like an anti-drug ad. And he's like,
Yes.
"Stop it, get some help. Don't don't take horse dewormer. Don't take that. That is animal grade medication, not for
So,
you."
so for some of them, there are YouTube videos who show you how to grind it up and take the appropriate amount.
It's not just the dose though. It's the inactive ingredients that are in the veterinary grade stuff. Don't no stop halt desist. Don't do it.
Hey, there is an angle on this that It weeds out the silly people. Come on now.
Yeah. I was talking with a friend about that because he's been getting like these crank calls, not crank calls, but like scam calls from like, Canadian Border Police. Your warrant has been issued for your arrest. Please call us back, and then they don't give a
Send
number.
money.
Yeah, but I was doing, just out of curiosity on my lunch break the other day. I was looking into that, and there's a reason. There's a reason that scams like that are still stupid. Like there's a reason that the Nigerian prince scam on email still exists.
Yes, there
Still is full of spelling errors and grammatical errors, and it's not because the people making the scam are dumb per se. It's because if you read that, not you,
Yes.
dear beloved smart listener, but if a hypothetical person reads that and believes it, they are the person that's dumb enough to give them money, and they're the person that they want. They don't care about people who see that and they're like, wow, that's pretty sus, because they're not going to get money out of that person.
Exactly.
It's like the first level of selection, trying to find suckers for that.
And there's a lot of them.
Unfortunately, yeah, because they still do it. They got to be getting some money out of that.
So stop with the horse dewormer people.
Yeah.
Or the
I mean,
cow dewormer,
although if
when
you think about it, this could just be a big play by Animal Pharma to get more people to buy ivermectin to drive their stock prices up. And maybe that's the whole impetus behind this entire COVID thing is big Animal Pharma. Screw big pharma. It's big Animal Pharma now.
Big Animal Pharma.
They're the ones behind it all.
There's an angle there, Will.
You heard it here first, people. You heard it here first.
On a more serious note,
more serious?
More serious. We're not laughing at horse dewormer people, even though they deserve everything they get. I want to go back to a picture from last week that we shared, and if you can read this for our fine folks, I think
I will.
This message is still as important this week as it was last week.
Yeah. So for those of you who are listening and not watching, public service announcement. When you are going to a store and there is an employee standing at the door and their job is to turn you away if you don't have a mask or health pass or whatever, please remember, he or she is probably scared as hell to even have to be in that position. They have no political affiliation with this. They may even be against it. Last but not least, remember, they are considered essential. They are not collecting unemployment and they have bills to pay. Please respect the retail workers. It is not their fault. I don't care what you think about masks, vaccines, health passes, etc. It costs $0, not to be mean, so don't be that person. Condensed down into a single sentence, don't be a dick. Stop it.
Unless your name is Dick.
In which case, be a Richard instead.
Ah, there you go. Okay, so be a Richard. Yeah, so there's a whole story behind that, which I won't go into, but if your name is Dick, it's okay to be a Dick.
It's okay. Yeah.
For the rest of you, stop. Even those of you who are militant against the health pass and the masks and the vaccines, absolutely, you can be militant, you can yell, you can holler, you can protest. I might even see you at some of them. But leave the poor person at the front door of Walmart or the grocery store or the drugstore. Yeah. Leave them alone.
I have a personal anecdote about that one. Actually, I was out at a show the other night on Tuesday. Mm-hmm. Went out to see some live music, and a gentleman came in while the band was setting up, and the lady running the place and serving drinks was wearing her mask as she's supposed to, mm-hmm. And the gentleman, who I kid you not, is on an oxygen tank. He's carrying an oxygen tank around me. So to say that he has respiratory issues is an understatement and a half. And this old feller's like, you don't have to wear the face diaper around me, lady. And was giving her grief for wearing her mask. And she's like, this is my business. I have to keep my business going, so I have to wear it, whether I like it or not. And he's like, yeah, but you don't need to wear it around me. Like, no, she has to wear it around everyone. She's just following the rules, man.
And he's there.
Yeah, literally. You can just hear him. We got sweet justice, though, because then he started giving the band crap because they were some young people from the Yukon. Music was great, by the way. Shout out to, I won't actually shout them out just in case people don't like our show. But yeah, to Paris Pick and the Pricks. Amazing performance. They were great. They're from the Yukon. They're traveling down through BC. If you get the chance to go see them live, for the love of God, do it. They were great. And yeah, he was giving them grief about their music, so he got kicked out. The owner had enough. And Paris from the band was also there. Yeah. And Paris and the band was like standing up with the owner, and she's like, "No, you leave, go, scram,
That's
whinge and
funny.
wheeze somewhere else." They didn't say it that gruffly, but
Oh, they should have.
I mean, I tipped them more than the cost of my drink because they were great. That was before the music even played. It was already a good show, and so I was ecstatic.
So please, folks, if there's somebody at the door, do not be a wienerhead,
A dingus.
a
Yeah.
dingus,
Don't be a
a
dingus.
dingleberry.
Don't be a tallywhacker.
If you need to know what a dingleberry is, look it up. You'll appreciate it.
I have a Flanders quote for you, Dave.
Oh gosh.
Don't be a dingly dangly diddly ding dong. Just for you, man.
That's for me.
Just for you. Straight from
On
Flanders
to the
flock.
topic of the week. So earlier this week, we met with some nurses, and I have a daughter who is a nurse in BC, and we've been receiving some emails and some letters about the state of healthcare in BC and actually around the world, although mainly North America.
Mm-hmm.
And it's a wreck.
Yeah.
And that's not. It isn't an understatement.
No.
It is.
I mean,
wreck.
like, COVID is wrecking hospitals and putting so much stress on the workers across the board, and then you compound that with the problems that healthcare workers up in our area in northern BC and whatnot we're already dealing with. Northern BC, Yukon, I think northern Alberta are all part of that, if I recall. And they've already had they've had staffing problems for as long as I can remember. They've been short staffed. It's a never ending problem, and this is just compounding it.
Yeah.
And it's getting ridiculous.
So there often is a natural animosity between nurses and doctors.
Mm-hmm.
Nurses really, they don't think the highest of all the doctors in the land, and doctors look at nurses and say, "Yeah, you're not as smart as us." There just is a rivalry between the two professions.
Yeah, not to throw like direct shade at doctors, but I think that exists between doctors and most other other professional healthcare workers, nurses, pharmacists, you name it. I think doctors are just very high and mighty.
And there are some good doctors, and I know some, and we're not casting shade on all of you, but there are some that have a chip on their shoulders.
$250,000 a student, that'll do that to you.
Oh, don't even get me going. This is a letter written by the doctor, the Canadian Association of Emergency Physicians.
Mm-hmm.
And I'm going to paraphrase it and say, our nurses are under fire.
Mm-hmm.
Absolutely and completely under fire. They're overworked. They are underutilized efficiently, if that's a phrase.
Their time is being poorly managed.
Yes, and there just is out and out harassment.
Mm-hmm.
And it has to stop. Has to stop. I have a daughter who is a nurse in BC in Northern Health. And this is an article from Northern Health that, that's the wrong one. It's on the verge of collapse. And nurses are feeling overwhelmed.
Yeah.
And they're the people on the ground who clean up after your puke, who clean up after you mess yourself as you're on an intubator.
Mm-hmm.
These are the people who care for you.
And yeah, I feel like it's worth clarifying as well. We're not saying that doctors are exempt from this pressure. Like we kind of poked fun at them earlier, but if you caught the snippet on that article, but there was in there that 17.
Which one, Will?
The last one, the CJ This one. Yeah, right there. A survey of Northern Health physicians said that only 17% of doctors felt their senior leaders made transparent medical decisions, the lowest of all health authorities in BC. So it's not just nurses that are fed up. The doctors also feel like they're getting screwed over because the people that are making the larger, like, quote unquote, corporate level decisions are not transparent about why, how, or when the decisions are being made. They're just being done. And it's putting pressure on these workers, and they don't know why or for what reason or where it ends, which is the worst kind of pressure. Like, I can look at, like, to draw a comparison to the pressure I've been dealing with this week at my job. My job is not healthcare. I'm not dealing with people's lives. And any, like, so the pressure is already way lower, not even in the same stratosphere. But I at least know there's an end to it. I know my pressure right now is caused by the fact that we have staff that's sick. When the staff is done being sick, they come back, the pressure will be alleviated to a certain degree. So there's a certain level of solace that I can take in the fact that there's an end in sight. These healthcare workers don't have that. They're just like, hi, here's all this extra work on your plate, all this extra stress and danger and all these things. Who knows when it's going to be over? Just keep chugging along. Slap
And
them
if
on
you
the
do
back
it
and
wrong,
away you go.
somebody dies.
Yeah, no
If you do it
pressure.
wrong, Will, if you goof up on a truss, you go back this way, you say, hey, I goofed up a board, would you cut another one? If a nurse or
Yeah,
a doctor goofs up because they're either overworked or overpressure, somebody dies.
yeah,
Could die. I won't say they do die, but they could die. And
they can. Yeah.
it is a... So I'm going to go on a hobby horse.
A hobby horse?
Hobby horse. I moved into the U.S. a number of years ago. And one of the things everybody asks me down here, and they say, oh, why could you leave the Canadian healthcare system? This is one of the reasons. Is every doctor, every nurse, they all deal with a finite budget.
Mm-hmm.
When they run out of money, they run out of money.
Mm-hmm.
And every decision that they make is based on money. Now, I know in the U.S., I know it's an issue here as well.
Mm-hmm.
But it's the exact opposite here. If you walk in a hospital here, you are a source of money. So they welcome you into the hospital. They want you to come in because
Mm-hmm.
you bring money. In the U.S., or in Canada rather, if you go in the hospital, you are an expense.
Mm-hmm.
It's a fundamental difference.
Yeah.
And I feel really bad for the doctors and nurses in Canada, because when you get a whole bunch either in the maternity ward or in the emergency ward or in surgery, or if you have an influx for COVID patients,
Mm-hmm.
all it does is it makes you work harder and longer, and they can't hire any more people.
Yeah.
And if they could, they don't, because it's Northern Health, and Northern Health is poorly run. But that's another story.
I don't think anyone's getting into that line of work because they want to get rich. No, nobody's becoming a nurse or an emergency services worker because they think it's some sort of path to fiscal success. Although, I mean, it's supposed to be a good, steady job and pay well, etc. But when they get worked that hard,
it's not worth the money anymore.
Yeah, they want to help people, I'm sure, but you can only help so many people. You can only have so much weight on your back before you start to buckle. They're only human too.
So I would say, and this is going out on a limb a little bit, except I do believe that a few of the folks in the industry, healthcare industry, are viewing it as a pandemic. Now, it is not a pandemic in the sense it's a virus. It is it an epidemic? I don't know what you call it, although it's rampant in the healthcare industry. It's overworked. It's a mental health issue for a lot of them because they are overworked and they are not able to handle it.
Yeah. I just think about how many. I look at this is purely an extrapolation from my singular point of view, and this may be completely off kilter and not relevant. But when I look at nurses in our local hospital or any hospital that I've been to in Canada, I don't see old nurses. I say old as in like only 40 and up, which isn't that old. I don't see a lot of nurses that are above the age of like 40 to 50. I don't. You would think they would want to, that would be a good career to retire on. You would think. But there's got to be a reason that there are not nurses sticking this out for the long haul, and it's probably because they're getting worked to the bone. A person can only do that for so long.
So now would be a great opportunity to insert.
We are not experts.
We are not experts. We are
We're
not
just
nurses.
Yeah.
We're not doctors.
We're two cis white dudes talking in front of cameras and giving our opinions. We understand that it's a very unique show concept that nobody's done before, but we do ask you to take it with a grain of salt.
And I just noticed, William, that my head is like 6 inches shorter than yours.
You're also a lot smaller than I am.
It's been
'Cause I'm big
bugging
and
me
buff.
for like 15 minutes. Hold on a second. This is killing me. And I can fix it. So guess what? I'm going to.
So what you're saying is that you're going to make yourself bigger on the
Ah!
screen so that we can spot the reflection off your head that much easier?
Oh, shut up.
Those of you who are listening and not watching can't see my shit-eating grin. It's there, I promise.
So add on to all of that, the overworked, the underappreciated, the immense amount of extra pressure for COVID and the masking and the protocols and everything else. Then add on to that the mandate you have to get vaccinated.
Mm-hmm.
And this is adding a whole nother level of angst, of extra pressure, of nerves.
I imagine it also is like it's driving wedges between people everywhere in every workforce. And I can only imagine it's the same in the healthcare industry.
And this is one of the headlines. You can read it if you like.
Excuse me. Yes. New York hospital won't deliver babies after unvaccinated staff quit.
You can read the next
Due to
one.
the number, an upstate New York hospital will stop delivering babies later this month, in part because of employees' resignations over requirement they be vaccinated against COVID-19. 6 maternity staff members resigned from Lewis County General Hospital during the past week, worsening an existing staff shortage. The Watertown Daily Times reported. The department has 7 other unvaccinated employees who also could decide to leave, hospital officials said. The number of resignations received basically dictates that they have to shut down the maternity department because they do not have enough staff for it to function.
This is happening in New York. It's happening across the continent.
Mhm.
USA and Canada. There are nurses who say, I don't think I need a vaccination. I've had COVID or for any other reason. They say, I don't think I need to get it. And it doesn't matter. And they're saying, I'm going to quit because of it.
Mhm.
Here's one of my issues with the mandates is when nurses and doctors are arguing against it, against the mandate. These are the people who aren't like you and me, who don't have any knowledge at all, who just have an opinion.
Mm-hmm.
These are people who have a bit of knowledge, may not have as much as Fauci. May he rest in pieces. But they are knowledgeable people. And they're saying, yeah, you don't need to make me do that. I've had COVID, or I've had it twice, or whatever the case may be. And when they're standing up and saying, nope, I'd rather quit.
So, yes.
I know you have an opinion, so go ahead. I'm not going to agree with it. That's the point of the show.
Well,
go ahead.
Sort of. Part of it you will probably agree with. So I look at it from a different perspective,
Okay.
where I see any workplace that I've been in you always will run up into people who, despite an immense level of expertise or knowledge or experience in their chosen field, can still do dumb things.
Mm-hmm.
And I look at healthcare workers and the ones that I have talked to in person and the ones that I've read about and the number of them that are in support of vaccinations as opposed to the number of them that are not.
Right.
From my point of view, this is not me saying this is absolutely the way it is. This is just me explaining my point of view.
Mm-hmm.
My point of view is that there is a certain percentage of healthcare workers that are incorrectly informed or wrong. I hate saying that because I don't have the authority to say that, but as I'm explaining my perspective, I view their hesitancy to get a vaccine as wrong and incorrect. But the mandate is, I still stand by what we've been saying repeatedly here over the last couple of weeks, that I don't agree that people aren't getting the vaccine. I think they're not smart for not getting the vaccine. But having a government mandate that says they have to isn't the best way to go about convincing them, especially when this mandate is going to force many of them to quit or resign or be fired when they're already like pre-COVID. It was a system under a lot of stress, then pile COVID onto it, and then cut back on staff numbers because some of them don't want to get vaccinated, is a recipe for the system just completely collapsing. Because at a certain point, they're only people and they're just going to give up. And they're not going to be able to do it. They're not going to be able to go into work. It doesn't matter how many lives they think they can save. Some days, some workers are just not going to be able to do it.
It's true.
And then what?
It's true. It's one of the things that I'm a member of a group of nurses on Facebook, and one of them was saying, I go to work and I'm not vaccinated, and the person who gives me the test says you have to take a test every shift. I don't know what it does, because apparently you can't get the results that fast. But anyways, that's another story. And she says, and that one is vaccinated, and she's giving me the test. And she said, it just is this awkward procedure that it doesn't make any, there is no logic. It just is, it honestly is the TSA all over again, the security of, or the theater of security. It's this idea, as there's no results on that test. So we don't know that she's positive or not. We have no clue. All it is giving her a test for and they don't know it. And she goes on and does her shift. It's hearing our leader in the U.S. yesterday. He said, we are going to protect the vaccinated from the unvaccinated. Mm-hmm. To which every unvaccinated
I'm sure that choice of words went over great.
Every unvaccinated person said, but you're vaccinated. Isn't that supposed to protect you? Like it just is this whole scenario where people are saying, wait a minute, just stop the train. Let me off this crazy train. It's
yes. I'm trying to think how best to word this. From my point of view, I also have a similar feeling of stop, let me off this crazy train. But again, from the opposite side of the coin, where, I mean, to first clarify, I think that a person saying protect the vaccinated from the unvaccinated is just a great way as a person in leadership to drive a bigger wedge between groups of people. Yeah. Smooth move, X-lax, genius. As Archer would say, phrasing. Bite me. But it's getting to the point where it's been so long through this pandemic trying to convince people that these various health measures have benefits, and seeing so many people regurgitate so many crackpot reasons for not. There are reasons to be upset with how the government has handled things, how Fauci has handled things, how various leaders have handled things. But for every one thing that is a legitimate criticism, there's 10 things that are absolute quackery. And from the point of view of someone who is pro-vax and whatever other title you want to attribute to it, weak and effeminate, it's It's
What was that lady on the thing the other day?
I'm holding on to that
A
insult
few
and
weeks ago.
I'm turning it into a joke. Yeah,
What
I'm
was the
turning it into
insult?
a joke.
It
Weak and
wasn't.
effeminate.
Was it
I
weak and
also got
effeminate?
one person called me weak and effeminate. The other called me a beta male.
A beta
Which
male. That's right. Are they
beta
not
male?
the exact opposites?
No, beta male is a weak or effeminate
Oh,
man.
okay, so it is not an alpha male. An alpha male would be.
An alpha male is big macho.
Oh, okay, you're a beta male. Oh.
Apparently, I'm a beta male because I'm open to new opinions and experiences. But
Are we
anyways,
all beta males that way then?
some people
Anyways.
aren't apparently.
Okay, go ahead.
But anywho, yeah.
Anywho.
So from my point of view, I look at this crazy train, and I look at some of the media personalities and some people that I've talked to on a personal basis that are just reaching the point where they're like, well, you know what? Just let them not get vaccinated and die off, and then we'll just go about our business, which is a horrible way of looking at things. For the record, let them die is not the right answer. Again, with the whole division thing, great way to make a them and us scenario, which I hate seeing it devolve into that with so much passion. But it's so hard to not become cynical, and I imagine that it is a similar, just inverted feeling from your point of view, where it's so hard not to be cynical about any medical advice or attempts to increase vaccination rates or whatever, because you look at the stupid things they have done and you're just like, well, here comes another one down the pipes.
Well, there are so many levels of stupidness. If a year ago or more, if they had looked at us and said, here are the numbers for those over 65 that it's killing.
Mm-hmm.
This is a problem. So let's get them vaccinated. Let's get those isolated and vaccinated as it's killing those. If you're over the age of 9, or over the age of 12, over the age of 15, if you're over the age of 3, it's not killing you. It's making you sick.
As much.
Yeah, I if you look at a graph, Will, I mean anybody.
Oh yeah.
It just is not. It is not a factor any more than anything else is a factor. So let's not worry about you now. It's not, Will. I mean,
it's the spreading. It's not necessarily a person being at risk of COVID
in that age group, except it is.
It did before too.
So we look at these things and we say, okay, here's what we're going to do. We're going to make everybody get vaccinated.
Mm-hmm.
When we know the people it kills are the elderly. We know that. And the people who have the pre-existing conditions.
Predominantly.
There's a school of thought out there, and I don't know this science, and so I'm not going to espouse it, although I do read it, that as you vaccinate, and this happens every year with the flu strain, it reads the flu shots, and it mutates into new things. And they're saying a few of these the new strains are the reaction to the vaccines. Is it true? Is it not true? I don't know. I don't think that we do, although it would follow science if that is the case.
Sort of.
So are
from my understanding, sort of.
So are we going to do this every year?
I would hope not. Not
well.
It's so not every infection mutates the same way or for the same reasons. You look at things like polio, and we vaccinated the crap out of it, and it didn't mutate into a new version of polio that required new polio vaccinations all the time.
Right.
By vaccinating it, we limited and eventually halted to a degree its spread, and so it became a non-issue because it just couldn't spread properly. And I don't know with any certainty whether COVID tends to mutate or not in vaccinated people. I do know that it mutates heavily in unvaccinated people. That is the cause of the Delta variant. Lots of people say that it isn't. People say that the Delta variant is the product of vaccinated people. It is not. The Delta variant and the Delta variant spread is through predominantly unvaccinated people. They're the ones who are filling up hospitals. It's unvaccinated people. So I can't say that COVID doesn't mutate through vaccinated people, but I do know for certain that it is mutating through unvaccinated people, and it is running like wildfire through unvaccinated people. The vast, I read an article. I can't say this article is empirical and for sure, but it says 90 to 95% of COVID vaccinations are in the unvaccinated in the States. Don't know about Canada, but so there's definitely a disparity there, and it would track that it's going to mutate as it jumps between people You're researching for me?
No, I'm chatting with a lady once on the show, and I don't know
Ah,
if she's watching or not. Um, it's one of the things, Will, that the it's hard to trust. It's hard to trust for those of us who look at government already with a jaundiced eye,
yeah.
and you have a fearless leader like yours who goes off and spouts about new world order, and then you have one of ours who,
Don't do that.
but I can because he is a drama teacher, and he's not prepared for the job. He's not. I
This
don't.
this is true.
He's
That is
not.
very
So
true.
it's
But
not.
New World Order is a stretch.
He said it. It was bad phrasing, exactly like our president is using bad phrases. Although it's one of the things that they say things like that, and they shouldn't. And it's one of those. I get so aggravated with the crazy people, with the horse dewormer people, and the people who leap all over the New World Order people. But
Nuremberg Code.
But the fact of the matter is, these are the people who are supposed to be smarter than us, and they're not, and they are using this for political means.
You know, I probably harp on this too much.
You have a prime minister who called an election
Oh yeah, dick
as he
move.
thought he could win it because of this.
Yeah, dick move.
And you don't think that he politicized it?
Oh, I mean, calling the election for sure. I think that people make bad phrasing choices because they're human. If you're a dude who's on camera every single day, you will make mistakes. Not that I'm saying that his whole new world economy comment is a mistake. I'm sure it wasn't. It's not new world order. It was a new world economy, and it was resetting the economy. The Great Reset. Great memes came from that. It was a wonderful
Yeah.
time.
Yeah.
But yeah, calling the election, big dick move, small dick move actually. Let's get our facts straight there. Some real
There's a
small dick
Richard
energy
move.
going on.
There's a Richard move.
Yeah, it was a small Richard move. That was the move of a guy with a jacked up pickup truck. That's what that
It-
was.
Will, I look at all these things and I see the I don't even know how to phrase it accurately. From those of us who doubt government, it kills us to hear these
get that.
things and to go through life with a mandate which was horribly rolled out in Canada,
Mhm.
the passport, health passport, or the vaccine passport.
Health pass.
Health pass, yeah, because we can't say vaccine anymore. It is.
We can. It's called the health pass, BC health pass.
It's one of the things that a month and a half earlier, or in May or 3 months ago, you have a health minister says we're not going to do it, and they turn around and say, "Oh yeah, we are, because it's good now." And nothing has changed other than the fact, hey, we changed our mind.
Well, lots has changed.
Yeah, but not about the
They're not.
disease.
They're not saying it gleefully. They're not like we want this. They feel like it's necessary.
It is.
That.
It's
So
so
it-
poorly done, and you want those of us who doubt them already to leap on board. And here's what I see, and this is the amazing aspect of it, is even those who are left of center are doubting them now and saying, I don't want to do the health passport thing.
I don't want to do the health passport. Like me,
Yeah.
Captain Progressive here does not want to do the health passport. But just because they adjust course and change the mandates or change what they feel is necessary for the safety of people in general is not an inherently bad thing. I trust a doctor or a scientist, or in this case, a government that changes based on new information and new facets to how things are going. I trust them more than a government who just staunchly says, we said this, we're going to stick to this no matter what. Because they could have been like, what decisions they made is 6 months ago, half a year ago. That statement may have been totally valid. They may have had every reason to believe, hey, We will never need to do this. There's no way it could get that bad. And now here we are. And they're like, I guess we do. And does that mean it's a good thing? Absolutely not. And I don't support it. But to I'm using it as an example that a government that changes course based on new information is a government that I trust more than a government that just says, no, digging our heels in. We're not changing for nothing, no way, no how. That is actually a perfect parallel to the whole to why I laugh and chuckle at this whole being called weak and effeminate thing. If being obstinate is a prerequisite to being a manly man, then I'm happy to not wear the title of a manly man. I want to change with new information and experiences and knowledge. That is a good thing for me and my perspective to adjust based on new input. And I don't really trust the government, but they're changing with they're rolling with the punches is not the thing that makes me distrust them. I just hate the bureaucracy and other reasons, but them changing their view and their standpoint is not one of them.
So I want to go back to an article that was I sent you last week. I think I sent it to you.
Okay.
It was about how the hospital in Prince George are overburdened with COVID patients.
Mm-hmm.
They're laying in the halls. There are so many COVID patients that we can't handle them. And I want to look at this line right here in the.
Just make sure you close your chat if you're showing a Facebook thing, so we don't see personal info there. We don't want to dox nobody.
It's right here in the middle, Will. Healthcare workers. If you want to read that.
While healthcare workers say the system is unsustainable as COVID cases continue to climb, hospitals in Fort St. John and Dawson Creek can't keep up, so patients are being transferred to Prince George. They say all of this could be prevented if people in northern BC started getting vaccinated and treating COVID as a life or death situation. My biggest fear is... No, that's okay.
I'll go back.
My biggest fear is that I'm caught up looking after patients years and years after that, and my family doesn't recognize me. My son doesn't get excited when I come home anymore, and you risk your own physical health and well-being for a system that may not recognize those efforts. There's a quote from a doctor.
So one of the issues in the healthcare industry in northern BC right now is that there's a shortage of nurses, overworked nurses who are off for mental health issues, as they just are wearing out and wearing down.
Mm-hmm.
There is a shortage, and so they can't handle the patient loads for anything, much less COVID.
Mm-hmm.
They end up in Prince George as there is a shortage of nurses, and the shortage of nurses is by their own, with the mandate thing, as we're hearing nurses saying,
I got to quit.
I'm going to quit. And then in your headline, you say, oh, yeah, we have our patients in the hallway in Prince George because of COVID. It's not because of COVID. I'm sure it's a factor. I'm sure it is there and contributing.
It fills up ICU beds real fast. When places like Prince George only...
The reason that there's a problem in Prince George is that all these other hospitals are shipping their patients there. They don't have the nurses or the doctors. And it isn't only COVID, it's everything.
COVID's just the straw that's breaking. It's the straw that's breaking the camel's back to a degree. It's a very big straw, but yeah.
It's a great headline is what it is.
I mean, but it's not incorrect.
Well, I think it is a factor, but it's not the factor. It's a shortage of nurses is the factor.
It's a very big one. I mean, Prince George is not doing great right now either because their ICU unit only has 10 beds. So they can't take much. So whatever people they're sending to Prince George, it's not a lot. Like the difference between empty ICU and full ICU is only 10 people. It doesn't take a lot to overburden that system beyond.
If your ICU is accepting ICU patients out of 8 other hospitals, it's not COVID anymore. It's a shortage. It's bad management on the part of Northern Health.
But it's also
COVID is a factor.
COVID's, yeah, it's just
It's a
taking what was
factor that
already a
is.
problem and
Yes.
exacerbating it, inflaming it
And I think that our
beyond what
healthcare
it was.
professionals, our nurses on the front line, our doctors on the front line, our nurse assistants, not assistants at
Nurse
the,
practitioners,
well, them as well,
because there's
our
RNs
our
and
LPNs,
there we go.
who are on the front lines of this, are absolutely and completely overworked, and they read these headlines and they say, but wait a minute.
Mm,
It isn't just COVID, it's the fact that you're working us to death and we're quitting.
that too.
So it's one of the things I feel that it is a system which it may break before it gets better, and I
Yeah.
hate to see that. It's breaking
So I
hearts
I
of
want to
people.
quickly before we move on from this, I do
Yeah.
want to add that I just got a message from someone that I do know that works in healthcare
Yeah.
in North BC. I'm not naming names, obviously.
Yeah.
And they stated that the reason that patients are being shipped to Prince George is not due to excess of people in these locations. It's due to places like Fort St. John and Dawson Creek not having the appropriate facilities. So they don't have the same ICU. They may have the size, but they don't have the equipment, is what I'm gathering, as somewhere like Prince George with a campus like UNBC on it.
Right.
So we here don't have the appropriate, whatever is required in an ICU. So they're being
Right.
shipped off because they need greater care than we can provide.
Gotcha.
Not just because of an excess of numbers. Just that clarification.
So what you're
That
saying
really
is one
makes
of
a
the
difference.
3 people that are watching us, or 2 people, know more than we do. Hot diggity.
One of the people that is watching tonight definitely knows more than we do. You know who you are.
And they're not commenting?
Nah, they're just messaging me and make me feel bad about how inadequate my knowledge is. They're not making me feel bad. They're humbling me, though. The Lord knows I need it.
It's one of the things that the media, even a little hole in the wall like Fort St. John,
Mm-hmm.
they like their headline.
I mean, news likes a headline.
And if that word is in the headline, it makes it sell. It makes it work. And I don't know that they are it's altogether honest.
Welcome to journalism, boys and girls.
Yeah. So anyways, we are going to have a guest on next week. I don't know who it is. You're gone next week, so it'll be me
Yep,
and
I'm
number
gone
one
next week.
fan
Yep.
Tim running the show. And we will have a guest next week. And
Mhm.
I'm
I'll be
not
on my
sure-
vacation next week.
Where are you off to?
I'm off to, is it Bear Lake, I think? Outside of Grand Prairie. Rented a little bitty cabin on the lake. Doesn't even have Wi-Fi. I'm gonna go build puzzles. I'm gonna go. Well, I'm leaving my phone in the car. Phone stays in the car. I'm gonna live my life building puzzles.
Show you schmuck.
All right, I'll be your one viewer.
No,
But anyways,
it'll be 3. It'll be 3 years. Next
well, yeah. Anyways, I'm on vacation. Bye. I'm leaving COVID behind for a few days
There you go.
to go hide in the woods somewhere on a lake. I'm going to stop being terrified of COVID and be terrified of boating instead. So
There you go.
just trade my fears.
Sounds good.
Can't wait.
So until next week, would you leave our viewers with a wrapping up message, William?
I would. Stay safe. Don't die.